When I wake up, my joints are stiff, hot, and swollen. What should I do? Rheumatoid arthritis is the second most common joint disease after degenerative arthritis. Also, it is an autoimmune disease that often occurs in relatively young age groups in their 20s and 40s. What is an autoimmune disease? Autoimmune disease occurs when the immune system, which protects the body from viruses or foreign invaders, becomes abnormal. It is a phenomenon that occurs when normal body tissues or cells do not work typically or work abnormally, or when our immune response reacts abnormally. It is difficult to establish what causes rheumatoid arthritis definitively. It is known that a combination of genetic and environmental factors causes an abnormality in the immune system and causes inflammation in the synovial membrane. A synovial membrane is a place that keeps joints soft and secretes joint fluid. A synovial membrane is a thin membrane that absorbs waste products in the joint, and inflammation occurs here. So, when the synovial membranes becomes inflamed, the joint fluid that helps smooth the joints between joints is not secreted well, and the waste products are not absorbed. This is what causes pain. An early symptom of rheumatoid arthritis is morning stiffness in the joints and fever and swelling in my joints. Rheumatoid arthritis affects joints throughout the body, such as fingers, wrists, elbows, shoulders, neck, jaw, hips, and toes. If you wake up in the morning and feel stiff joints for over an hour, you may suspect rheumatoid arthritis. Unfortunately, there is currently no surgical treatment for rheumatoid arthritis. Until now, treatment that slows down the deformation or progression of joints is in progress. So, it is recommended to proceed with stem cell therapy using your cells to treat it safely. When stem cells, which are undifferentiated cells capable of differentiating into various human body tissues, are administered intravenously, the stem cells normalize the level of inflammatory responses caused by the immune response. Let's listen briefly to a lecture by a doctor from EHL Bio. Many types of these autoimmune diseases exist, but the treatment is very similar. First of all, in most cases, autoimmune diseases invade joints to some extent, so anti-inflammatory painkillers are prescribed. While using this drug, a drug called corticosteroids is used, but steroids have many side effects, so they are used only for a short period of time. Then, there are drugs called DMARDs. From the name, it means medicine that improves the disease. Unlike drugs that make you sick, it is a drug that slows down the disease's progression and treats it. However, there are several side effects. There may be diarrhea, nausea, side effects such as recurrence of tuberculosis or hepatitis B, or an increase in the possibility of cancer. The treatment of rheumatoid arthritis also carries out all medicines mentioned above. However, even with these treatments, 30% of patients may have joint problems. Of these, 10% can be so severe that the joint is entirely disabled. About 25% of cases require joint replacement surgery. Also, most importantly, rheumatoid arthritis can be accompanied by cardiovascular diseases, etc., which can reduce life expectancy by about 10 to 15 years. Stem cell therapy for autoimmune diseases is to regulate pathogenic memory T cells. In the case of ordinary people, the balance of helper T cells 1 and 2 is essential. But in the case of this disease, there is an excess of 1, so many pathogenic T cells are produced, resulting in illness. Stem cell active regulatory T cells to maintain the balance between helper T cells 1 and 2, consequently treating this disease. This paper is a review published in the 2020s, and it is a collection of clinical trials that treat autoimmune diseases using MSC. You can see active clinical research going on. Most of the studies on rheumatoid arthritis are for patients with incurable diseases who do not even respond to DMARDs. Standards in all the studies written here, it is said that CRP, ESR, TAS-28, etc., which are representative activity indicators of rheumatoid arthritis, are reduced. Promising results were observed in terms of safety and effectiveness. And the striking part was that these were the results obtained from patients who had been resistant to other drugs for a long time, and there were no side effects.